Quervain's Tenosynovitis is the next condition that we will discuss. So what it is it's a condition that affects two of the muscles of the thumb or of the hand that it creates tension and stress and inflammation around the muscle itself, as well as around the connective tissue that kind of helps hold the tissue or hold the muscle in place. Now, what we tend to see this condition come upon is when people are using their hands a lot. So a lot of desk workers tend to get this. You may play a lot of video games, or you may do a lot of gardening, something that kind of just requires a lot of use of the hands and the thumbs, as well as recent studies have shown that high frequency of text messaging or playing on your phone might also bring this on more. So typically we will see patients come into the office with this condition. The condition may come on suddenly, very abrupt, or it could come on over time. It could come on over several weeks or months, but typically we're going to have the pain and the discomfort in the lateral aspect of the hand or in the thumb. Some people would also describe kind of discomfort over what we call the anatomical snuff box, where it's just kind of right here where the thumb and the wrist meet. People will get pain and discomfort when they try to use the thumb, or they move it in some direction, or they have to type, or they have to text, or something along those lines. So that's typically what we will see. Now, patients have in the past had this condition kind of show up, especially if they have, there is a correlation between rheumatoid arthritis as well as diabetes in this condition too. So that's something that we kind of tend to see in the office with this condition. So in the office, how we tend to treat this condition is just utilizing a good bit of soft tissue treatment. So we do a lot of cupping and then some Graston technique onto this area, as well as, we might mobilize or adjust the thumb and the wrist and just kind of make sure everything's moving well, as well as we will work a little bit into the forearm and start working on the muscles like the extensor muscles or the flexor muscles of the wrist. Now, typically after a trial of care, 4 to 6 weeks is a good trial of care for something like this. If it's still kind of lingering, then we might kind of push you out to kind of get imaging. Now, the best type of imaging for this would maybe be like a diagnostic ultrasound, or you could possibly get an MRI. That also will be a good alternative to that. So what we will tend to send you home with, there's a lot of good exercises and stretches for this condition. This condition does have a lot of inflammation associated with it, so we will kind of promote ice and rest and maybe a little bit of anti-inflammatory medication just in the short term to try to kind of get rid of some of that. And then we will teach you kind of the stretches and the exercises that kind of strengthen that area as well and kind of balance things out. But realistically, this condition tends to be the worst when you kind of provoke it. So we're going to try our best to keep you away from doing those activities that tend to provoke it a good bit. Especially in the short term, because we have to kind of get that inflammation reduced and kind of get everything relaxed a little bit. yourself or you know someone that might be kind of struggling with wrist or thumb pain that may kind of be related to this Quervain's tenosynovitis, and we'd love to help. So give us a call at the office at 513-463-3011, and we will be happy to take a look. Thanks.